Hi, I'm Dr. Ballard, and right now I'm going to talk to you about the idea of getting a second opinion for your surgery. Having a major operation like having your hip or knee replaced is a very big decision for anybody, and it's pretty complicated. One of the principal things you have to decide is who's going to do your surgery. That can be intimidating and a little bit hard to come by that decision. Because of that, it's very common to get a second opinion when you're debating having your hip or knee replaced. And I see people frequently for second opinions. Sometimes they just have seen a surgeon and want additional information to see if they're on the right track. I've even seen people before that already have a surgery date picked out and have either heard about me or they just want to get an opinion to make sure, again, that they're on the right track. Both of those are visits that I'm very open to and that I do quite frequently in my practice. If you're seeking a second opinion, don't be intimidated and don't be nervous. I do these kind of visits all the time. All you need to do is call the office and come in and see me, and I'm happy to help you regardless of which way our visit goes. Sometimes people are coming in to see me just to validate that their decision to go into surgery and the surgeon they've chosen is a good one. And if you end up with a surgeon that I think is skilled and talented, and there are a lot of those, then I'm happy just to help you validate that and feel comfortable. In the end, how our visit goes is not material. What is material is how you feel and the confidence you gain towards going towards your procedure. If that means you continue with your plan and go with the surgeon you've chosen, that's great. And if it means that I take over your care and provide your surgery, I'm just as happy to do that. The main thing is that you feel comfortable coming into the office to get that opinion to help you on your journey and as you go towards getting your hip or your knee replaced.